Hey everybody, Dr. Hagmeyer here, and welcome back to video number 6 in the series, Is the Pill Wrecking Your Gut? Now if you're just tuning in, I've been talking about the many ways that the pill wrecks your gastrointestinal function and how it causes IBS symptoms. In the past videos, I talked about the pill and gut dysbiosis, I've talked about the pill and gut inflammation, I've talked about the pill and leaky gut, I've talked about the effects the pill has on gastrointestinal motility, leading to SIBO. I've talked about the pill and its effects on gallbladder function. And so if you missed any of those videos, you can go back and watch them, and I'll leave links to each of those for you. But in today's video, I want to talk to you and focus in on how the pill affects liver and thyroid function. The liver plays a huge role in hormone health, and so the effects that the pill has on the liver is one of those critical pieces that's often missing in traditional treatment for correction and improvement in women who suffer and struggle with hormonal imbalances and digestive problems. Now, today's video, I'm also going to talk about some of the symptoms you should be aware of when it comes to having a sluggish liver. Now, there's a couple important things and a couple important ways that the pill affects liver function. And so let me give you what those are, just in case you want to write those down. And then a little bit later on, I will unpack those so that you can have a better understanding of really how the pill creates these problems. Okay? So number one, the pill increases something called sex hormone binding globulin, or SHBG for short. Okay? Number two is that the pill increases something called thyroid binding globulin, or TBG for short. Right? Number three is the pill robs your body of many vitamins like vitamin B12 and folate and B6. And you'll see here in just a moment why these are so important, but these are critically important to phase 1 and phase 2 of detoxification in the liver. Number four, the pill, because it often induces gut dysbiosis, it can potentially allow toxins from the bacteria in the gut to travel to the liver, causing more stress on your liver. All right. Now, you probably already know this, but the liver is our primary organ of detoxification, and it works to remove toxins and waste from the blood, all while filtering out and sorting nutrients that our bodies need for daily functioning. To say that the liver is important would be a huge understatement. All right? Some textbooks say that over 500 different functions can be attributed back to liver function. All right? So nearly everything we ingest, from medications to alcohol to vitamins to nutrients, they all go through the liver and handle the toxins. Now, the liver uses a two-step detoxification process to filter these toxins in the bloodstream. We call this phase 1 and phase 2 detoxification. In phase 1, the liver repackages these harmful chemicals into less harmful ones so that the body can get rid of them through elimination pathways. Okay? These chemicals are then converted into water-soluble substances that are secreted through bile or through urine or through feces in what's called phase 2 detoxification. Now, the key to healthy liver function is removing those things that are placing stress or putting a burden on the liver, such as the pill. All the things that we've been talking about through this entire video series, can the pill wreck your gut, is applicable here. Now, the next thing you want to do to support your liver is, of course, provide the liver with the nutritional requirements, or nutritional support, if you will, needed to support those pathways, phase 1 and phase 2 detoxification. If we look at the needs of the liver in order to run these detoxification pathways, you're going to notice that both phase 1 and phase 2 detoxification are heavily dependent on various B vitamins, on vitamin C, on various amino acids, on folate, which is a B vitamin, on glutathione, and finally on flavonoids. What does this have to do with the pill? Right? Well, if you're guessing the pill is not good for any of these vitamins, you'd be absolutely correct. Right? The pill robs your body of these very nutrients, and the liver depends on. And of course, if we don't give those nutrients back to the liver, that whole metabolic process of detoxification is going to slow down. And as you can imagine, that's not good. All right, so let me show you a couple studies here. Here's one study showing, titled The Effects of Oral Contraceptives on Vitamins B6, B12, Vitamin C, and Folate. Here's another study showing the effects of the pill on B12 levels and the consequences of the pill on bone mineral density. And yet, here's another study titled Nutritional Effects of Oral Contraceptive Use, a Review. Now, this study showed that the pill does a number of harmful things, and it basically summarizes these findings by saying that the pill causes the deficiency of 8 different kinds of vitamins, 3 different minerals. But what I found especially interesting, incredibly interesting to me as it relates to gastrointestinal function as well as mental health, is that the study, like many others, also go on to show that 80% of women in this study developed problems with something called tryptophan metabolism. Now, you may not be familiar with something called tryptophan, but tryptophan is an amino acid that gets converted into something called 5-HTP. And that finally gets converted into serotonin as well as melatonin. So if we have too little tryptophan, right, because the pill has disrupted how tryptophan is metabolized in the body, that's going to cause a decrease in serotonin production, which can then lead to all those symptoms such as depression, chronic pain, anxiety, fear, constipation, and all those other IBS symptoms. The study also goes on to reveal that elevated copper and vitamin K are very common. So let's break that down just a little bit, because that's really important. Now, why would this be so important as it relates to the pill? Well, here's why. Too much copper can cause depression and anxiety, and too much vitamin K can lead to blood clots and pulmonary embolism as well as bruising. One of the B vitamins that the pill depletes is vitamin B6, and so if you have anxiety, you surely don't want to be deficient or have low levels of vitamin B6. Okay, if you look here, B6 is a cofactor, meaning that we need to have B6 in order to make something called GABA. Now, GABA, as it relates to anxiety, GABA is a neurotransmitter, so it calms the body down, it calms the brain down. So think about a person who's constantly all revved up, somebody who's anxious, someone who perhaps maybe suffers with insomnia, they can't sleep at night, their legs are twitching, they have restless leg, or their nerve system is in this fight or flight state. Well, GABA, again, being that neurotransmitter, it is one of the primary neurotransmitters that calms the body down. So again, that B6 deficiency can cause anxiety, it can cause depression, it can cause fatigue, it can cause brain fog, it can cause insomnia, it can cause restless leg. And it also can cause a rise in something very, very important to the brain known as homocysteine. Right? We know that when we have elevated levels of homocysteine, not only is that so damaging to the heart, but it's so damaging to the brain. So if you suffer with anxiety, I recommend that you watch some of the videos that I've done on my YouTube channel where I specifically talk about homocysteine, and I go into that in much greater detail. But what you may have noticed was that this study was done in 1980. And so some of you might be saying, oh my gosh, that study, that's ancient. Come on, Dr. Hagmeyer, you got to have studies that are more recent than a study that was done 40 years ago. Ha! Well, I do. So if you take a look at this one, this study was done in 2013, confirming the same thing that we knew back in 1980, all right? So what have we learned in almost 40 years? Well, I think if we look at what the World Health Organization says, and it says it perfectly, it says the influences of oral contraceptives on nutrient requirements is a topic of high clinical relevance and should therefore receive great attention. Well, in 40 years, I would probably argue that that's not happening. It's really not receiving a whole lot of attention, right? Most doctors today, I think, are just better at prescribing anti-anxieties, antidepressant pills, and sleeping pills, right? We have more depression, we have more anxiety, we have more hormone imbalances, we have more problems than ever before, but perhaps that's just my clinical observation in 20 years. Now, another problem that I routinely see with the pill, with all its synthetic high doses of estrogens and progestins, is, like I said in the opening of this video, is that it increases both sex hormone binding globulin and thyroid binding globulin. Both of these should be tested periodically, especially if you're taking the pill, or if you've ever taken the pill, you've received fertility shots, you wear a patch where you have thyroid disease. All right, now let me explain these a little bit. Anytime your sex hormone binding globulin or even your thyroid binding globulin levels increase in the blood, the end result is going to be less sex hormone and less thyroid hormones that are available to your cells. This, of course, creates this deficiency-like state when these levels of sex hormone binding globulin and thyroid binding globulin go up. They're like a sponge, and so when these levels are up, they suck up, if you will, or bind up these free hormones, and this, of course, is going to create those symptoms of a hormone deficiency state. But if your doctor never checks or retests these hormone levels and only relies on your symptoms, they may increase your thyroid hormone dosage, they might put you on stronger, higher doses of estrogen, And this could be a disaster in the making. Of course, it's not going to remedy your symptoms. And in fact, if this happens, what's going to happen is that your liver, it's only going to make more sex hormone binding globulin. It's also going to only make more thyroid binding globulin, which creates this round and round vicious cycle. And the more deficiency symptoms that show up, the more medication and hormones and thyroid replacement that your doctor is going to prescribe. This is why testing and retesting becomes so important. Never, ever, ever let a doctor put you on a hormone, whether it be thyroid hormone or any kind of hormone for that matter, without testing you within a 3-month period or less. Okay? This is just a common scenario that we see play out over and over and over again. In fact, just a few months ago, this was happening to a patient that reached out to me that we just started working with. Her doctor had put her on the pill, and because her symptoms didn't improve, he prescribed a stronger dosage of hormones. And when she first got to me, when I evaluated her sex hormone binding globulin, these levels were in the high 300s. They were about 5 or 6 times where I like to personally see them. If you look at the lab reference range, perhaps you've actually had this test done, you're going to notice that the reference range goes from 24 up to 163. And while I believe that those reference ranges are just way too high, I personally like to see these 40 or 50 or even 60. But one more thing that I think is important to cover in this video before I wrap this up is that what are the signs that your liver is struggling, right? There's many, many symptoms here, but the first sign that you have a sluggish liver or that your liver is struggling is going to be of high cholesterol, right? As I said earlier, one of the main functions of the liver is to retain or is to really maintain a healthy level of fats in the bloodstream, right? For the average person, approximately 80% of the cholesterol is generated by the liver. And so a sluggish liver will show up as having elevated LDLs, or these are also known as your bad cholesterol. The other thing you may see on your blood work is you may see low HDL cholesterol. These are your good cholesterol. And the thing to understand about these HDLs and this good cholesterol is that it's cholesterol that becomes the backbone or the precursor to making many other hormones in your body. So it's never good to have low cholesterol, and of course it's obviously never good to have really, really high cholesterol. Now, what else might you see on blood work? Well, you may see something called triglycerides being elevated. You may see elevated levels of ALT or AST, and these are liver enzymes. Okay? You may notice stubborn weight gain, especially around the belly. All right? So those are all markers that show up on standard blood work. And so if you see those things, your liver is really screaming and trying to tell you that it needs some help, it needs some support. The second area of the body that indicates that the liver is struggling is really what this video is all about, right? This video series, and it's digestive problems, right? So out of the many, many functions that the liver does, one of the most important is to produce bile, right? We talked about this in the last video a little bit, but bile helps in the digestion, right? It's through this process of emulsification that lipids are absorbed, right? Those fat-soluble vitamins that we eat get broken down and get absorbed. You remember in the last video we talked about the gallbladder, and I said that it's the liver and the gallbladder, how they work together, right? They work with one another, and how important bile flow is. Well, a sluggish liver produces less bile, and it's the liver that makes the bile, and it's the gallbladder that stores the bile and then squirts it into the intestines that helps with the digestion process. So if the liver is not producing sufficient amounts of bile, let's say because you have imbalances in your hormones that are tied back to the pill, well, then a person may experience symptoms such as bloating. They're constantly feeling bloated. Maybe they're burping and belching all the time, especially when they eat protein or fat. Maybe they have constipation. Maybe they have an inability to digest fatty foods. Maybe they have a loss of appetite, especially in the morning, right? The third area that I want you to be aware of, that I want you to start thinking about in terms of a sluggish liver, it involves allergies and skin conditions. Now this may be things like psoriasis, it may be dermatitis, it may be eczema, it may be cystic acne. All right, so let me explain that a little bit. The liver, again, plays an important role in eliminating toxins from the body and maintaining the efficiency of the body's immune system. If the process of eliminating toxins is slowed down, right, that phase 2 detoxification perhaps is slowed down, or in the case where, again, birth control pills and that excess estrogen is slowing that process down, what happens is this toxicity builds up in the body, and that shows up in one of the major excretory glands of the body, and that's your skin. So you end up with skin irritation, you end up perhaps with hives, maybe you end up with itching, maybe you end up with skin and food allergies that develop, okay? All things that are possibly very early signs of a sluggish liver. Now, another area of the body that we can have a problem with that relates to a sluggish liver is blood sugar and blood sugar stability. Now, you may have drastically improved your diet. Maybe you've been eating good over the last 4, 5, 6, 7, 8 months, but yet your hemoglobin A1C, maybe even your glucose and your insulin levels are still slightly out of range, or maybe they're even still high, right? Now, if you suffer with symptoms such as a loss of appetite, fatigue after a meal, frequent thirst, fatigue, irritability if meals are missed, changes in mood or cognitive function or brain fog, then this indicates that there is a high likelihood that you have a blood sugar problem. You have dysregulation of blood sugar. And so I recommend that you monitor your A1C levels and your insulin levels on a 3, 4, 5 month period basis. You're getting those checked every 3 to 4 to 5 months. You can't rely solely on glucose in many cases. Okay, so in other words, if all you're having done is getting your glucose levels tested and you have those symptoms, but your glucose levels are in the normal range, I recommend that you talk to your doctor and get those A1C levels tested and insulin. Now, another area affected by the liver, and this has been the topic of this video series, is the pill wrecking your gut, is hormonal issues, right? The liver is responsible for filtering out the breakdown or the metabolites of hormones. So a person with a sluggish liver would experience symptoms such as a regular period, heavy menstrual cycle, maybe light bleeding, maybe a change to the duration of the cycle, maybe passing large blood clots, dark red clots, maybe fibroids if the condition, the hormonal imbalance has been going on long enough, maybe depression, maybe hot flashes, maybe cysts on the ovaries, maybe mood swings, all those symptoms that if you're struggling with a hormonal imbalance, you're probably very well aware of. So, as we wrap this video up, I know we've talked about many ways that the pill affects the liver and the thyroid. So let's do just a really quick recap here. Number one is that the birth control blocks thyroid function in that it robs your body of these critical nutrients needed for proper thyroid function. The pill is a downright thief when it comes to certain vitamins and minerals needed for proper liver detoxification and proper thyroid function. Number two is that the pill can affect tryptophan metabolism, and this can lead to problems with serotonin production. Serotonin affects the brain, but it also affects things like gut motility. And serotonin is a precursor to melatonin, which we need to sleep. So again, symptoms like depression, anxiety, fear, constipation, bloating, these are all common symptoms seen with tryptophan metabolism problems. It can also cause excess copper and elevated levels of vitamin K. High copper is seen in anxiety and mood disorders. And three, the pill can cause estrogen dominance, right? If you have already know that you have estrogen dominance, you know, if you don't know you have it, you eventually will develop it, okay? I tell women that all the time. If you're taking the pill, you either have it or you're going to develop it. It's just a matter of time, right? And this estrogen dominance, of course, creates this situation where you have these levels of estrogen favoring estrogen as opposed to progesterone, right? Your levels of estrogen compared to progesterone are favoring that excess estrogen. And this could lead to things like, again, heavy menstrual cycle periods, weight gain, endometriosis, mood disorders, depression, blood clots, irritability, hair loss, and just the list goes on and on, right? Number four is that the pill affects your thyroid and sex hormones because it increases both sex hormone binding globulin and it increases something called thyroid binding globulin. Now, this sometimes shows up on blood tests, you know, so if you've had thyroid testing, let's say you know you have a thyroid problem and maybe your doctor maybe even tested your thyroid levels. What you should be looking at are low T3 levels or even low testosterone, right? Those are things to look for. But you'll never know that if your doctor doesn't test those. So again, I do encourage women with hormonal problems or being on the pill that you do get your testosterone levels tested. You also get your total T3 levels as well as your free T3 levels, okay? And finally, the pill blocks the uptake of thyroid hormones into the cells, which means that the thyroid hormone can't get into the cell, and your sex hormones also can't get into the cell. All right. And finally, if I didn't mention it already, which I know we have, the pill causes a sluggish liver and a sluggish gallbladder. All right. So that's going to wrap up today's video in terms of the pill's effects on the liver and thyroid function. I hope you enjoyed it. I hope you learned a few things. I hope that you feel just armed with information so that you can make more informed decisions about your health. And remember, if you're struggling with any kind of chronic health problem and you're just tired of being the proverbial sick and tired, there are always ways to get better, okay? Visit my website, learn more about functional medicine. And if you're looking for help, click on the Start Here tab on my website, complete a questionnaire, and then let's figure out what's wrong with you and what we need to do to get you back on track and healthy again. Until next time, keep digging and don't give up. Take care.